What role do resident services play within affordable housing communities? Joining us is Susan Davidson, Vice President of Resident Services, Affordable Homes and Communities, to tell us. Susan, it's so great to have you on the show today. So, we're going to kick off with how do resident services in affordable housing communities influence the overall well being of residents?
Um, Thank you for having me. I'm happy to be here. Let's begin with access to affordable housing. We know that housing is a social determinant of health. Having affordable housing, which we would define as housing that costs 30% or less of your income, um, having that stable housing provides the platform from which you can achieve higher level needs, as we all know. Um, when affordability is challenged, health and mental health concerns can be exacerbated. And so, with, at affordable homes and communities, we provide affordable housing, but we also provide service enriched housing. Our resident services in our communities play a critical role um, as a platform for security across several domains, including health and education, financial, and social engagement. We have resident services, resident engagement specialists in our communities um, who work where individuals and families live. That is the key difference in providing these services in affordable housing. We provide access to physical and mental health services um, and provide psychosocial education that introduces a holistic approach to that many of our residents have not had access to.
Well, you spoke a little bit about mental health, and we want to jump into that within our next question. So, what prevents residents of affordable housing from getting mental health services?
There are multiple barriers to lower income households receiving mental health services. First, access to affordable mental health care. Many of our residents work in lower paying positions that um, perhaps don't come um, with health insurance, or if it does, the deductibles are so high that it's prohibitive. Um, Also, we find in lower income and BIPOC communities, there is still very much a strong stigma and cultural norms that preclude you from seeking mental health services. It's more of a pull yourself up by your bootstraps. You can do this on your own. There's no one. I think also there are the waiting lists at healthcare that is at mental health care that is affordable in the state and county levels. The wait lists are so long, and now we're at a place where you are only seeing people for crisis situations, and so you're the depression and the anxiety, um, the PTSD that many of our families, many of our individuals suffer from because of all the trauma exposure within their lives. Um, they can't be seen until it is beyond serious, until their life is threatened.
Oh, that's so scary. So, how can affordable housing resident services be tailored to meet the needs of different demographic groups?
At AHC, we begin when we are looking at providing resident services in a community. We begin with the demographic information, who's going to live there, and then we hire culturally sensitive, bilingual or trilingual resident engagement specialists who begin their service on a property, really providing more community building and engagement opportunities as a way to get to know residents. Mistrust is also a barrier to receiving mental health services or health services. And so our team begins in that first year, really trying to get to know the community, who's there, um, what strengths do we see? What challenges are we hearing? And using that information and working along with the residents, we design a services plan for the entire community that can include those things that I talked about earlier: the mental health care, the education, financial, economic mobility, those types of services based on the particular needs of that community. We have 24 communities in Arlington, Virginia, and we have different service plans at all 24 because the needs of each community are different.
Can you talk a little bit about the on-site addiction recovery services at the Montverde Senior Living Community in Baltimore?
Yes, absolutely. This is an exciting new program that we established a health and wellness suite this past year, just recently opened, that includes um, in partnership with the National Capital Treatment and Recovery Center and with Integra Health, and we have partnered together to provide a substance abuse treatment for the residents and living at this community for seniors and persons with disabilities. Um, the the partnership was made possible through a grant from the Tomei Aging Well grant. We could not have done this. It is as I know, one of the first affordable housing communities that has an actual addiction treatment center on site. So we were very excited about that. We are already seeing people participate, um, both neighbors and residents with addiction issues. We found that during COVID, um, the the isolation, the eviction moratorium, which put more money in people's hands, was this an unintended consequence. Um, when you're an addict, any extra money can help feed the addiction, and we found that as we went through that period of time and after that, we really were seeing such an uptick in the behavioral issues and the health issues that come along with addiction, and really felt we needed to do something.
Oh, wow. Thank you so very much, Susan, for being on our show today.
Great. Thank you so much.